Welcome, everyone. My name is Sarah O'Connor, and I'm the Program Director in the Office of Community Engagement here at the Medical College of Wisconsin. Welcome to our September edition of the monthly Community Engagement Spotlight Series. Please note that this session is being recorded. At this time, I'd like to begin with a statement from the Office of Community Engagement. We wish to acknowledge the Indigenous people who are past and present stewards of the land on which we pursue our just cause of a healthy community for everyone. To our audience members, please be sure you are muted throughout the presentation. We do encourage everyone to use the chat bar freely to share comments or pose questions for our guests. We will be monitoring your questions throughout the session, so please do feel free to send any as they come to you. This monthly series features community partners and the important work they are doing for and with the community. We highlight their goals, their motivations, and their accomplishments, and the ways they have partnered with people and programs at the Medical College of Wisconsin. Today, we are deeply honored to have Dr. Jeffrey Oswald and Kimberly Shibilski from the Wausau Free Clinic joining us as our featured guests. At this time, I would like to introduce our Senior Associate Dean for Community Engagement, Dr. Stacy Young, who will say a few words about the Wausau Free Clinic's important work for the community. Dr. Young.
Thank you so much, Sarah. The Wausau Free Clinic was established in 2018 by Dr. Jeffrey Oswald, Jeffrey Todd, Paula Vogt, and Jane Shibilski, and a small team of volunteers. The driving force was addressing the unmet primary care needs of low-income, uninsured individuals, many of whom are immigrants and people of color. Initially, the plan was to remodel space in the church, but an invitation to join the Community Partners Campus of Wausau, a partnership to house local nonprofit organizations in one shared location. While waiting for the Community Partners Campus to be built, the medical mission team operated in several temporary facilities over the years, including in a warming center and a church basement. Their 2,500 square foot state-of-the-art medical facility opened in December of 2022. All services are provided free of charge by local volunteer doctors, nurse practitioners, physician assistants, nurses, support staff, and MCW students. The clinic is also committed to offering a unique educational experience for medical students, one where the impact of the social determinants of health is obvious with every patient encounter. Thank you, Dr. Oswald and Kim, for being our featured spotlight guests today. I would now like to introduce today's facilitator, Dr. Corey Norbaum. Dr. Norbaum is an assistant professor at the Medical College of Wisconsin, Central Wisconsin campus. She co-directs the Physician in the Community course, through which she mentors students in community-engaged scholarly projects. Dr. Norbaum serves as the medical director for the Hmong and Hispanic Communication Network, known as H2N, and Rural Resiliency Network, R2N, networks of community health workers in central Wisconsin. She has practiced full-spectrum family medicine in northeastern Wisconsin for 12 years and has worked as a rural general practice doctor in New Zealand. Dr. Norbaum, thank you so much for serving as our facilitator today. I now turn it over to you.
Thanks so much, Stacy. I think we're going to go ahead and get started with Dr. Oswald is going to be presenting just a little bit of background about the Wausau Free Clinic, and after that we'll have some conversation.
Sorry about that. I was just mentioning that Dr. Young just gave my whole speech, so I don't really have much to say anymore. I really do have something to say, but a lot of the history that I was going to go over, she addressed already, but I'll just briefly go through some of that. Chai, do you have the first slide on? Is that on there? Okay. This slide depicts all our major partners that have allowed us to do what we do. I'll be discussing these partners in more detail a little later. You can also see our mission statement on the slide, and which basically says that we will provide high quality health care to all low income individuals without health insurance. At this point, I was going to give you a little history on our free clinic, and I'll still do that. Even now, I find it pretty hard to believe how far we've come in such a short amount of time. Jeff, Todd, and I first met in 2017 to discuss the idea of starting a free clinic in Wausau. Jeff was a retired public health officer and clinic administrator, and I was a still practicing family physician. We both felt in our community that there was a real need for a free clinic. Initially, our plans were to remodel the basement or the lower level of the First Presbyterian Church where Jeff was a member. After receiving the church's approval, we started fundraising to reach a goal of $250,000. While we were waiting to reach this goal, we chose to begin an outreach clinic in the homeless shelter at the local Catholic Charities. We wanted to kind of get an idea, get our feet wet to see if this is something we could really do. We began seeing patients on Wednesday evenings since nurses from Aspirus Hospital were also volunteering at the homeless shelter at that time, and they could help us with our patients. There were also a few medical students from MCW that also began showing up and helping out at the clinic at that time. And I've told Corey this before, I don't know how we got together, but it started around this time, and it had to do with medical students showing up at the warming center and seeing that we had an outreach clinic. Within several months of starting this clinic, we were approached by the leaders of the Community Partners Campus to join this new nonprofit organization. Their goal was to purchase and renovate a large building within our community to house several human services organizations like ours under one roof. We quickly decided to accept their offer, which obviously changed our plans, but it wasn't a good way. Here's a picture of the Community Partners Campus now today. When COVID hit in the spring of 2020, we had to close our clinic, but eventually reopened in the basement of the First United Methodist Church, a different church, in January of 2021. At that time, we expanded our service outreach to include low-income and uninsured residents. Up until that time, we were just seeing residents of the local warming center. We also had grown to 3 providers, several nurses and administrative staff, and our first AmeriCorps volunteer. We moved into our new expanded state-of-the-art clinic within the Community Partners Campus in early December of 2022. And here are some slides showcasing the clinic. We now have 5 exam rooms, 1 procedure room, a laboratory, and a medical dispensary. And this allows us to serve more patients, accommodate more volunteers, and partner with more allied agencies to deliver services to our patients free of charge. We're open 2 half days a week, on Tuesdays from 3 to 7 and Thursdays from 1 to 5. Next slide shows our volunteer staff, and I'll get into that a little more, but we currently have 13 volunteer providers, 11 volunteer medical specialty consultants, 13 nursing volunteers, 8 pharmacy volunteers, 5 reception volunteers, 1 AmeriCorps service member, MCW medical students, UWPA students, 3 interpreters, and our first paid full-time clinic coordinator, which you haven't met yet, but Kimberly's on here with me. All our services are free of charge, and that includes all medications, labs, diabetic supplies, imaging studies, and durable medical supplies such as home blood pressure monitors. We provide both in-house and telehealth mental health services. We have a diabetic educator on our volunteer staff who helps with dietary guidance and insulin management. We offer free screening for breast, cervical, and colon cancer. We refer patients for free legal services when needed. We supervise medical students and PA students. We perform minor surgeries such as skin biopsies, endometrial biopsies, laceration repairs, skin cyst removals, and partial and complete toenail removals. We also administer vaccines. We have on-site Hispanic and Hmong interpreters, in addition to telephone interpreter services for other languages. We have a large group within our community, a large group of providers within our community who have agreed to serve as telephone consultants with our on-site providers. And these include, I'm going to read these: dermatology, pediatrics, cardiology, pulmonology, endocrinology, gastroenterology, podiatry, OBGYN, infectious disease, ophthalmology, and orthopedic surgeries. Again, all our services are completely free, and we provide these services to anyone who has low income, and we define low income in our clinic as less than 300% the national poverty level, and if they have no health insurance. So I'm going to come back at this time to the partnerships we've been able to develop over the past few years. These partnerships have allowed us the ability, or given us the ability, to offer a full range of outpatient primary care services. But before I discuss these partnerships, I again want to point out that another very important reason we are able to offer so many free services is because we essentially have all our staff are unpaid volunteers, and this includes 48 volunteers. Our only paid staff, as I mentioned, is Kim, 2 Spanish interpreters, 1 Hmong interpreter, and our AmeriCorps volunteer. Obviously, without our support, our volunteer staff, we would not be able to offer the services we do. Having said that, we've been able to develop some pretty remarkable partnerships over the past few years that have allowed us to expand our free services. So let me just go over some of these at this time. So there's a slide that's showing now, and I'm going to discuss each one of these individually. And Kim, I want you to come and involved with this too, when and Corey, if you have some things you want to say. The first one is we utilize both the Dispensary of Hope and Direct Relief to stock our dispensary with most of our prescription medications we prescribe. Remarkably, we even have access to medications like Trulicity, which I checked the price on GoodRx this morning, and it was $800 per month. Dispensary of Hope charges $7,500 a year for all the medications we get from them. In just 5 months, I think we've stockpiled, I want to say stockpiled, we prescribed, but we have $85,000 worth of medications. We just signed an agreement with Direct Relief. Marshfield Clinic currently performs all our lab testing for free. We collect the lab specimens in our clinic, and a Marshfield courier comes by every morning after clinic to run the labs. Kim, do you want to say something about mental health?
Yeah, so we also have several mental health options and services within our clinic. We work with a nonprofit Open Arms Free Clinic out of Elkhorn, Wisconsin. They have bilingual counselors that are able to assist, and it's telehealth. So the patient can either come to our clinic and use our telehealth monitors, or they can also do it at home, which has really been very helpful. We also have an on-site psychiatric nurse practitioner that can do assessments as needed on-site within our clinic that same night.
As far as colon cancer screening, Marshfield Clinic supplies our patients with free FIT testing, and we're able to process, and we're in the process of finalizing a partnership with GI Associates to perform colonoscopies on patients with a positive FIT test or those who are at high risk for developing colon cancer. GI Associates has also talked about doing endoscopy for other reasons too. You're next, Kim. Breast and cervical cancer screening.
Sure. So we have a couple of partners in that as well. We work with Health First that assists with any cancer screenings that we refer over, as well as the Wisconsin's the state program called Well Women program that helps with cancer screenings as well.
As far as minor surgeries go, we weren't able to do any minor surgeries because we had nobody to read pathology or pathology specimens. But recently, Associates in Pathology in Wausau agreed to read all our pathology specimens free of charge, including pap smears and HPV testing. As far as health system also funded us recently to upgrade our procedure room to give us the ability to perform usual outpatient primary care procedures that we couldn't do before. And again, that was based on us being able to get pathology specimens read for free. As far as IT goes, I'll let you do this, Kim.
Sure. So we do utilize an EMR called Practice Fusion. We have laptops donated from Marshfield Clinic that the providers use to help dictate their notes. And then we are working on website design and our social media presence, but we're still working on getting that updated and up and running.
I should also mention that Marshfield Clinic's donated Dragon voice recognition software, and you probably didn't catch this, but one of the founding members of our clinic was Jane Shibilski, Kim's mother, and she's a retired transcriptionist. So she also transcribes our notes. We all have an app on our iPhones, but we're also getting these other services for other providers. MRI scans, Smart Scan Medical Imaging agreed to perform 2 MRI scans per month on our patients about 4 months ago, free of charge. That's been great. Hispanic and Hmong interpreter service. I'll let you, Kim, on this. And maybe
Sure.
Dr. Norbaum, you might want to chime in on this too.
So we got a CDC grant that we were able to hire some Hispanic and Hmong interpreters to be in person in our clinic, which has greatly helped our patients to have that in-person service, as well as going into the vaccine access. We have Marathon County Health Department that has on-site immunization clinics, as well as Aspirus Health helps us with flu vaccines every year. And then the Wisconsin State DHS offers the Vaccines for Adults program that we will be giving adult vaccines at our clinic here as well. I'll also jump into legal services. So this is, we often have patients that have additional needs and, come to us and talk to us about medical bills that they have. So we started to look at other nonprofits that may be able to assist them, and that's where Judicare Legal Aid comes in. Legal Action of Wisconsin, ABC for Health. These are all other options to help our patients with, medical bills, immigration problems. That there's a lot they can help with that we can just help refer out for some additional assistance.
And now finally on this slide is, oh no, another slide. That's right, this is a new slide because this is our MCW partnership. Dr. Young kind of mentioned it in her introduction, but the most important aspect of our partnership with MCW students is giving them the opportunity to work in a clinic where they can easily see firsthand how the social determinants of health affect the patients we see. Although we appropriately talk about the social determinants of health, it's a much more powerful learning experience if they can actually work with individuals that are so negatively affected by these social determinants. Also, several students have utilized the Wausau Free Clinic as part of their pathway projects. We also received donated medical supplies and OTC medications as part of some of the medical students' projects. They've also given us valuable input into our clinic operations. In fact, the first medical student to volunteer at the warming center, Rachel Lang, was part of designing our logo that you see today. And finally, Kim, oh wait, I forgot about this last one. Kim seems to think that the medical students' presence in the clinic will also have a positive effect on our providers' cognitive functioning. And I'm assuming she's saying that because most of us are Medicare age.
It keeps them sharp.
But I also, before I get off this slide, I also want to add that Dr. Norbaum's support of our clinic has also been remarkable. Without her help, we would not have near the support in the Hispanic and the Hmong communities that we have today. And I'm sure we'll get into that. I hope we get into that when we field questions or Dr. Norbaum wants to ask any questions.
Sure. And I mean, I guess I can just kind of off of your other slide too, you saw some of the pictures in the beginning as far as with vaccination clinics. The Wausau Free Clinic has been a critical partner for the Hmong and Hispanic Communication Network and Rural Resiliency Network, H2N and R2N, which are networks of community health workers that came to be during the onset of COVID. We have been doing pop-up vaccination clinics as far as influenza vaccines, and the Wausau Free Clinic is our vaccinator, meaning that they back us. The vaccinators actually putting shots in arms are like me and also some other MCW faculty, but also the medical students. And so we are official volunteers through the Wausau Free Clinic, and we take these vaccines out to farms, churches, community events, just trying to reach people in places where they are, and then to be able to link them to the free clinic if they are uninsured or underinsured. So it's been a great partnership.
You want to just go over the demographics, Kim?
Yeah, the slide you see in front of you is just a general breakdown of the patients at kind of the typical patients we see. It's right down the middle for gender, a little more towards the 35 to 64-year-old patient age. And as far as race, right, it breaks it down there. Ethnicity and preferred language are, I think, very interesting. So 74% of our patients, are Hispanic, Latinx, and they all 70% prefer Spanish. So that's where it's critical we have those interpreters on site to help us.
If anybody would like to get involved, this is how you would contact us or donate to us. We are applying for a grant to improve our website design and social media presence. Right now, we haven't updated it in a while. So if you do have an interest, this would be the best way to contact us. Again, I hope within the next 2 to 3 months with grant funding, that will be significantly improved.
Thanks so much for the overview. And I have a question for both of you. So why did you get involved with the free clinic? I mean, like, this is a major undertaking, and if you could just give the audience a little background into why this is a really important thing for you.
Well, first of all, I had no idea it would become this big undertaking. I look back at when we started, and I really have no idea that. I mean, today we have 48 volunteers. It's unbelievable. Before we moved into the CPC, we probably had half that, and so moving into the CPC was incredible as far as people knowing where we are. I first became interested when I was serving on the board of the Salvation Army. In my private practice, I never really saw individuals that didn't have health insurance that were low income. And so it was an eye-opener to me when I was on the Salvation Army board. And then when we started the other thing that's interesting, I assumed then when we did the outreach to the homeless shelter, that would be a population that we would work with. But in reality, most individuals that are unfortunately they're unhoused have Medicare, Medicaid. And so when we opened up the free clinic, we saw a whole different population of patients that I frankly wasn't aware of. And I think a lot of people who are in this field aren't really aware of it. And it's just been eye-opening. I retired in May of this year, and I thought, man, I still like doing this. And so this just gave me an opportunity to help out in the community and do something that I think I'm good at and I like doing. And I think it also gives the people in the community an opportunity to help out. In the medical field, we rarely get the opportunity to volunteer to utilize our skills. The only opportunities we really have is to go outside of our state or outside of our country to do mission work. The free clinics really offer people the opportunity to volunteer within their community. And even when they're working full time, they can volunteer a half a day a month. It's been really remarkable. Our community's been really supportive, but I'm sure the same story plays out in other communities in Wisconsin and in the United States. Unfortunately, free clinics are needed, but people want to volunteer.
Mm-hmm. Yeah, I found that pretty much the same as, when we first started this. For me, it just echoed giving back to my own community. And then once, we moved into the CPC, everything grew so fast, and this has just been a great opportunity to give back to my community, and it's just been an honor.
The Community Partners campus is pretty remarkable. We have a video at the end of this that will link. I think it's going to be a link, but if you have an interest in that, I'd encourage you to watch it, because I think it's something that could really be done in any community. And it really makes a difference for the other nonprofit human service organizations to all be under one house. I've learned so much being in this one building about agencies I never knew anything about. So it's been really helpful, not just to me, but obviously to the people that utilize those services.
Yeah, that the CPC has been such an important piece of it. Now when, normally when we ask our patients those general questions, do you feel safe at home? Do you need help with food assistance? Typically, in every office setting, they were just given a brochure or a referral. Now we can literally just walk them down the hall to that service and get them hooked in, the same day. They can go home with a box of food the same day that our clinic is running. So that's been a very key point, having those partners so close.
And I can give you a little bit of background too. Some of you might, wonder, well, why is there such a large Hispanic population demographic at the free clinic? But we've had a massive demographic shift here in central Wisconsin. And I mean, literally the 7th congressional district was the whitest congressional district in the 1970s in the country. And now there are pockets, like basically Abbotsford, Wisconsin is now, like 70% of the children in their elementary school, 70, are Hispanic. And so it's been this tremendous shift. With the 2020 census, there are 15,000 counted in this central Wisconsin, like 8-county area. However, there's probably half as many or more undocumented that aren't counted in that. And so, like, in working with these networks of community health workers, I mean, we struggled about, like, what can we do to help these folks access medical care, because they qualify for nothing unless they're dying, or pregnant, but basically it's so wonderful for the community health workers to be able to know now that, like, as of like January of 21, like, that there is the Wausau Free Clinic. And so word of mouth travels quickly because they get excellent care, and having interpreters there are just, like, it helps as far as the comfort level. So I'd also like you to tell me a little bit more about your partnership and working with the medical students, because I know in their pathway projects, they've ranged from, like, analyzing whether homeless people have health insurance to, like, trying to check into the conditions that people are wanting to be seen for. They've conducted focus groups, like trying to find out what kind of services Hmong and Hispanic communities might be looking for. We even have somebody doing like finding out about, like, what cultural aspects there might be with advanced directives. So if you could comment some about some of the medical students that you've worked with, that would be awesome.
Well, the medical students have been great. And I'll talk about some projects in general, but it's just really great to work with medical students because they're at a different stage in their career than I am personally, and many of the individuals that volunteer at the clinic. And most of us always enjoyed teaching. So that just in of itself is really helpful. And Kim put that thing on the slide at the end about dementia. But in reality, it really does get us going. It's invigorating. And so that part of it's great. Also, I find it really educational on our point of view when medical students come up with ideas of how they can, study the population of patients that we see. Like, for instance, Grace Wittenberg's project that you talked about, advanced directives. That's not something I would have ever thought about in the free clinic, but yet taking those surveys and seeing the results and realizing that this population of patients do have an interest in that, and how can we improve that, is something that we just wouldn't have thought about before. And I think there's other projects like that that have been really helpful for us. And I think there's going to be projects coming up that can really help us too, improve the care that we give.
And Kim, did you have anything to add as far as with the medical students?
No, I think he covered a lot of it. I'll just echo a lot of what he said. It's been such a great experience having the med students there. Our providers, they love to teach. And, there's so many times I look over and they're quizzing the med students and what about this diagnosis? What did you see and hear when you talk to this patient? How would you treat it? It's just so interesting and I always like how Dr. Oswald always talks about how this is a different patient panel than he ever saw in his private practice. It's just a different patients you're seeing. And I think it's so important to have the medical students rotate through.
And it's probably, oh, you're muted. You're muted.
Yeah. I think to follow up on that is that when you're in when I was in private practice and I didn't work with a lot of people that had no insurance because they wouldn't come to see me if they had no insurance. It's really when you see unfortunately, how many people there are in our community who don't have insurance or don't have the income to come to see a physician. I think as a provider, you can hopefully train young physicians to look for that, to ask those questions, and to realize that there's people that aren't going to tell you that unless you ask.
I think like one thing like to kind of add to that too is just the health navigators. Some of the community health workers are certified health navigators with Covering Wisconsin. And so some of these families from Latin America are very complex in terms of their immigration situations, where one person might qualify for, like Medicaid, another one was born in a different place. And so it's very complex, and being able to have certified health navigators help patients going next steps and figuring out where they fit in, what they might qualify for, is also really important.
Mm-hmm.
So I guess could each of you share what's one of your favorite success stories, as far as could be about a patient generically, it could be about your work in general with the free clinic?
Well, I'm going to give you two.
Yeah.
Can I get two? I'm going to give you two. One that has to do with the CPC and one has to do with the individual patient. And I use the first example a lot in my presentations. It was a gentleman who came to us when we just opened at the First United Methodist Church. He came in, he had lost his health insurance, but had lived here for 18 years, still undocumented, but working on a farm. He had lost his insurance or something, but he couldn't afford his insulin. So he had been off insulin for 2 months. He had lost about 15 pounds. His blood sugars were in the 400 range. His vision was blurred all the time. And when he came to see us, we were able to get him his insulin that day. Within 2 weeks, he was back to his usual self, and he was able to continue to do his job. And he's followed us for the last 2 years, and we've been his primary care providers. And I think without us being there, that he would have been in the ICU in DKA pretty soon after that, which leads to another point, and I don't want to divert, but I will, that we save the healthcare organizations a lot of money by having free clinics in the system. We save that healthcare system probably $100,000, and that happens all the time in our clinic. The other example I want to give you is a woman that came in this year who had delivered her baby 3 months ago. She was having problems breastfeeding and had mastitis. So when I saw her, I obviously treated her for the mastitis. She said she was really struggling with breastfeeding, and she was going to use formula now, but she didn't have any money to get formula. She didn't have any money for diapers, and they were really struggling with money for food and with rental assistance. All four of those agencies are in our building. So we just walked her down the hall, and she got help with all four of those. She left the clinic that day with formula, diapers. I shouldn't say the clinic, the CPC, with formula, diapers, food. What was the other thing? Anyways, it was all in that one building, and it was a really uplifting experience.
Mm-hmm.
Okay, Kim, I'm sorry I took over your time.
You took my story. No, I do have another one. It's very similar to his second story where there was a mother, it was actually a family that had walked for, I think, 7 months, walked here from Central America. When they finally arrived, they had no clothes on their backs. They had no food. They needed medical care. We were able to get them primary care, medications. They left with boxes and boxes of food. They had everything they needed to at least get through the weekend, and then they were going to come back to the CPC the following Monday, get hooked into housing. I mean, it was just an amazing story. They were so grateful. They were crying. It was just a wonderful connection.
So here's the question. So where do you see the free clinic, in the next year or next 5 years? Like what's the trajectory? What do you see happening?
Well, I wish I knew. My goal is to be able to give high quality healthcare that one would receive anywhere else in the country in primary care. And that would include things like if somebody comes in and needs a CT scan, that we can get that for them free, x-rays, anything that they would be allowed, or that they would expect to get in a primary care setting, that they would be getting in our setting. And that would also include referrals to subspecialty care. I know that that's a pie in the sky hope, because frankly, everybody in our country hopes for that. But it's even more acute for individuals who don't have insurance or are low income. We've come a long way. We're close. We still have some big holes like x-rays, CT scans, and ultrasounds. That's a big hole for us right now. But we've been able to cover most everything else. I also hope that we can, feel like we're going to have turnover and younger people coming in to take over the leadership spots in the next 5 to 10 years. And I think that will happen. And I'm hoping that this will be a long-term clinic for the next 10 to 20 years. Actually, my biggest hope would be that they wouldn't need free clinics, but I unfortunately don't see that happening.
Some of the goals I always talk to Dr. Oswald about and our other leadership about is right now we're only open 2 days a week for only four hours each. So in the future, I would hope we can get to additional days, just like a regular clinic, some additional volunteers on, and operate like some regular hours. Right now, we're maxing out and it's working with our couple half days. But that's what I see in the future.
Great. And as far as the medical students that are like new M1 students and project interest, we have one that's interested in helping with the quality metric so each of the free clinics that are part of the Wisconsin Association of, help me out here, free charitable clinics, yes. But like that they're going to be doing some quality metrics, and she also happens to be bilingual and speak Spanish, so it'll be really helpful like as she's seeing patients. And then another student is really interested in taking a look at what impacts working at the free clinic has on medical students. So she's still kind of taking a look at, like what she's exactly going to measure, how she's going to do that. But I know that the medical students are very interested in Grace that you mentioned is like has started a schedule system, because basically to be able to have like enough time that the medical students actually have a chance to see patients, but be taught. I think that, they're doing a great job in terms of being realistic about your capacity. And so we'll hope that we can kind of keep expanding upon that as you guys are able to expand.
MCW has done a great job with getting medical students involved with the community and seeing clinics like this and patients that we see. That's not something I had in my education. I'm learning a lot now, just as medical students are learning coming through. These are all new things that I didn't deal with when I was in private practice. And so I think MCW is doing a great job with that. And thanks, Corey, for doing that.
I think it's really cool too, getting them involved with community health workers, because I think so often we can be focused on what happens within the walls of a clinic, but to actually be out in the community, whether it be doing like health and resource events with the community health workers or putting vaccines in arms, I think it gives them a little bit more, like of an idea of what it might be like in this rural community. Or we actually had a couple of students, believe it or not, as part of our intro to pathways this summer, that we sent to some different rural places, and one was to a farm that we had done some pop-up clinics, and two of them had never seen a farm. So it was really interesting for them to get, like an idea about like, oh, this is what a cow looks like, and this is how they milk them. So I guess I'm starting to see questions in the chat, and I don't know if you'd like us to start taking a look at those questions.
Sure, I was just looking at them now. Which one do you want to go through first, Corey? I'll let you direct it.
Sure. So have any of the students looked at doing a cost analysis of the impact the clinic has had on diverting care from emergency departments and local hospitals? That's a complex one. We'll just say that that's something that is being attempted now, but we have a little IRB like hang up. So
I know that one is being attempted because we were approached with that about 6 months ago, and we thought it was going to be an easy thing, but it's turned out to be not so easy, because I think frankly, it would really help us with grant writing and that too, that we can document that this is the money we've saved healthcare organizations. They all know we are, but it would be nice to be able to document that.
Yeah, so that's definitely an idea that has come up. Okay. And then Sarah, what is that, IT that you're or
Oh, it.
I was just trying to type it because I have returned. But I can just say it. I was just interested in and impressed with how you have such a volunteer-heavy organization. And I'm interested in any best practices and tricks that you have for really engaging your volunteer workforce and tips for sustaining that.
Boy, that's a big question. As far as our volunteer staff, we've been really fortunate that a lot of the people that are on our board, if you will, our leadership team, are really well known in the community, and have a really good reputation. And so they would go out and ask individuals or tell individuals about our free clinic. That especially happened in nursing services. I mean, within a matter of time, we had 12 RNs volunteering.
We have a wait list right now for RNs to get in.
Providers, it's what I chose to do is I asked both healthcare organizations in our system, Aspires and Marshfield, if I could send an email to all the providers in their systems that work in this area, telling them about our clinic and if they would be interested in volunteering. And we got a lot of volunteers through that. We're trying to talk with we have talked to the emergency rooms and the hospitalists in the area to tell them about our services. And so now we're getting some hospitalists that are volunteering, some ER docs that are volunteering. There's in fact one ER doc that does point of care ultrasounds for us, but she's full-time, so she's only here about once a month. And then administrative staff, that's the same thing. We have some people that are really well respected in the community, and we've just been really lucky. I'm convinced, though, that free clinics in general, I don't think I don't want to say it's easy, because it's not, because you have to make sure you have a free clinic that works well in that, but people want to volunteer. They just want to have the ability to volunteer someplace that makes sense to them. And I think free clinics offer that opportunity. I don't know if that makes sense. I don't know if you want to add in, Kim.
Nope, that makes perfect sense. That's like I mentioned, we actually have a wait list, which is a very good problem to have for a clinic of volunteers waiting to get in and to rotate through. As far as sustaining and, like I said, it's just about our volunteers just really want to give back, and especially our clinic and our patients we see are so grateful and thankful, and it just really makes you feel good about volunteering there, and it's just been very heartwarming and uplifting to volunteer there. So we've been very lucky.
Oh, you're muted, Oz.
I've always told people when I was in private practice, people were appreciative of my care, but it's not on the same level as this. And so it's pretty uplifting. I mean, you see pretty difficult, terrible things that people have to deal with, but the appreciation they have for you is pretty dramatic.
Just like one other thing that I would touch on too, like in terms of like when you guys are thinking about future, one thing that is a barrier in rural areas in particular is transportation.
Mm-hmm.
And so Marathon County itself is like the largest county by area, but I mean, the patients that come from like probably an 8-county radius. I mean, there's probably a smattering that might come from other places too, but it's a very large area. And driver's licenses, you probably hear about, like the issue of people that are undocumented and not being able to get a driver's license. And that definitely, like, even though they may drive really locally around the farm or the place that they work, to come all the way to Wausau is something that's really difficult. And so I think something that goes through my mind is thinking about, like, is there some way to be able to have some type of transportation versus, even outreach in terms of in like thickly populated areas, like in that Abbotsford area, because right now it seems like, like that's the primary population that's being served.
I think those are really good points, Corey, because we do see people from all over. We're the only truly free clinic in this area. I shouldn't say that. I think Marshall has a real small one right now. They don't offer the services we do, but we see people north of Minocqua, south of Plover, west of Abbotsford, in the Green Bay area. But I think outreach would be great for all the reasons you talked about. That's a big endeavor. But I think I used to think telehealth would work, but I'm just not convinced of that. I think it would be better to, especially with trying to get people to come in. I think that probably outreach clinics would make more sense.
I know it's such a vulnerable population, and like just even access to do telehealth might be really difficult.
Yeah.
So are there any other questions, or, like Stacy or Sarah, do you have any questions?
I'm also interested for any comments or recommendations or things that anybody else has done that, you could give us some advice with your experience.
I mean, for me, one comment, I don't have a question. I mean, I will say that as a faculty advisor for a free clinic here at MCW and also sitting on the board of the Wisconsin Association of Free and Charitable Clinics, I can just attest to the value of having this safety net across so many communities in the state. And, what you all are doing is just phenomenal. I mean, the fact that you've got a waiting list and individuals that are really wanting to step into this work and also to mentor our future healthcare workforce. I just think that's so important, and just recognizing that people just have so many different needs, and, you know, building the type of clinic that includes so many different individuals that provide not only, you know, direct medical care, but also other types of support that we know patients need. I just can't give enough kudos for doing that, and doing that so, I should say, faithfully over so many, you know, over such a period of time. And the need in the community is great, for sure.
So I don't know, Oz and Kim, do you have any, you know, like kind of closing thoughts that you'd like to share?
Nothing that I haven't already said, to be honest. I think that free clinics are important. I think that if somebody has the interest in starting a free clinic, that communities in general will support this. I don't think Wausau is that unique. I think other communities see the need and would support clinics with funding and with volunteers. And we're more than happy or open to helping people look into that in their local community. It's pretty remarkable how people really want to volunteer in clinics like this.
Yeah, I don't have too much closing to say, but yeah, it's been a remarkable experience so far.
Well, and thank you so much for welcoming us as guests today.
Thanks so much, Chloe. Thanks everyone for joining us today. If those individuals here on, and thanks everyone for joining us. For those that are interested, there's a QR code on the screen. If you are so inclined to give to the Wausau Free Clinic, there's a link to do so. Please join us next month for our next spotlight session. It will be October 25th at 4 p.m. Details to follow. Our featured guests for that session. Thanks so much, everyone. Thanks again, Dr. Norbaum, Dr. Oswald, for joining us. Everyone has a beautiful and safe evening.
Thank you very much.